Have a conversation you need to hear about stomach cancer that accounts for 1.5% of all new cancer diagnoses in the U.S. each year. That's according to the American Cancer Society. That may sound like a small number, but it means more than 26,000 people are diagnosed with the disease every year. And that number is expected to grow in 2025. Because of that, we need to put a spotlight on this condition, and now is the time. Today, we want to bring in Taylor and Lisa Persicchiti, who lost their loved one to stomach cancer. We're talking a little bit in the break, and we want to share your story with viewers. Of course, our medical expert, Dr. Payal Kohli, is here, and we'll get to her first. But I want to talk to you guys. You lost your son, your husband. Can you share with us a little bit that you were talking to us about during the break?
Yeah. We just kind of want to get awareness for young people because it can happen to anyone. Like, I married Ryan in October of 10/10/2020 is when we got married. And 3 months later, he was diagnosed with this horrible disease. And it just came completely out of nowhere. I was talking to Dr. Kohli earlier about how he was the healthiest man that I knew. He worked out, he didn't smoke, he drank like normal, like just not to excess, nothing like that. And we did genetic testing and everything. It just came out of complete nowhere. And I just want everyone, including young people, to just be really aware that this can happen to anyone at any time.
33 years old. I mean, that just hits you in the heart, Dr. Kohli, but this is something that you've been seeing.
It's really, really becoming increasingly common for us to see young people getting diagnosed with cancer, sometimes without those risk factors. And the stomach is sort of our first kind of interaction with the environment. So if you think about anything that causes chronic inflammation in the stomach, whether it's alcohol, smoking, obesity, but even the foods that we eat, even the environment that we're exposed to, the pesticides, the dyes, the colorings, we're really, really seeing an increase in young people getting these types of diagnoses, where normally this was a disease of aging or getting older.
And so are there risk factors we can be looking out for?
So I would say the biggest modifiable risk factor, something that you can change too, actually. First, of course, alcohol. We've talked about no amount of alcohol being safe. Your stomach is the first thing that sees the alcohol. But the second is something called H. pylori, which is an infection, a chronic infection with a bacteria that a lot of us carry around. Sometimes it can be symptomatic with things like heartburn, easily treated with antibiotics, and it can reduce your risk of stomach cancer substantially.
And I know, with Ryan being healthy, and Lisa, you were saying you feel like early detection is necessary because this isn't something, right, that everybody is just screened for, and you feel strongly about that.
I do. I wish that we could direct more awareness for all cancers, but especially stomach cancer. And it'd be nice to be able to address the younger generation that don't know about this and make them more aware of their bodies. And I mean, even though this just hits and you don't know.
I know that picture.
It just needs to get out there that people need to be aware. And it's hitting younger people. It's not just for old people.
Is widespread screening, Dr. Kohli, something that's in our future? What do you think?
I think as the landscape changes, we may have to start thinking about that because we lose people like Ryan. I mean, look at this beautiful couple, this beautiful son who we lost all too early to something like stomach cancer, which we wouldn't have expected. Right now, on a population level, it's not really cost effective, meaning we might pick up more false positives than true positives, and the way to diagnose it is with a biopsy. So I want every single person to take a lesson from this loss that we've had of Ryan, which is that be attuned to your body and your symptoms. If you're having satiety, nausea, heartburn, fullness, weight loss, chills, anything that could suggest that something's not right in there, you go to that doctor early, because the earlier you get screened, get diagnosed, the more likely you are to get cured. And the cure would look like, obviously, a surgery to take out the stomach, reconstruct it, chemotherapy, radiation as well. It can be a tough road, but it certainly can be treated if it's picked up early.
It's incredible. Taylor, Lisa, I want to leave the last word with you. If there's anybody out there who's watching who's going through what you guys have been through, and still, grief is, such a journey. Any message for them?
Just trust your heart and your gut as far as going to the right doctor. And if you're not feeling comfortable with that doctor, then go on to the next one and make sure you're going to get the right treatment. And make sure you ask questions. And if you feel like they're sugarcoating it, say, we just need to know the truth.
And you shared with me, Lisa, that in Ryan's case, there was a bit of a struggle getting him connected to the right doctors, having him feel comfortable with the care and the treatment plan. And so I can't emphasize that enough. I mean, medicine is very challenging right now. So to be your own best advocate and trust that little inside voice that advocates for you, it's really so important.
It is.
I would say listen to your body. If you feel like anything is off, just go get it checked out. Like, I know even my family, I'm like, okay, you feel weird, like just make sure you go get it checked out. I'm always that way to all my coworkers, to everybody, just telling them, go get checked out. Like, you never know. And I use that card a lot. Like, you just never know. So trust your body, go get checked out.
Yep. Your story is powerful, your advocacy to be here today and to share even more so we appreciate you. And I know a lot of people watching do too. Thank you.
Thank you, guys.